Welcome to E3 Strength. Today we're going to be talking about foam rolling. My name is Earl, and you may have seen some of the exercise videos that we put out every week here at E3 Strength to help get you guys results. Now, along with those results, we want to accelerate them and increase your recovery time. One of the ways to do that is foam rolling. Now, I know that you guys have a hard time doing this because you don't understand really what it does or what it is, and we're going to try to explain it to you with little to no BS. The foam roller is just a cheap massage. It's called myofascial release, which is exactly what a massage therapist does to you, except for you can own one of these for $25 versus the $150 it costs to go get a massage. And that's what we're gonna work on. So I have sore legs, I worked them yesterday, and I'm feeling a little tendinous tightness on the inside of my knee. Now that's likely due to tension on the inside and outside hip flexors. How do I treat that? Well, stretching's great and it does help, but with foam rolling, you can just massage those areas. So that's what we're gonna do. Now these are big areas with lots of connective tissue. So all I'm gonna do is knead them like I'm kneading dough. So you're literally just gonna roll back and forth. Now for the inner thigh and outer thigh, and that's the example we're using, that can cause tension in the knee or tightness in your hamstring and a lot of other problems, you're just gonna knead this like you're kneading dough, generating blood flow, breaking up scar tissue, and making you feel a lot better. Now when you're doing this, all you're gonna do, knead up and down from the iliac crest, that's the top of your hip, all the way down to the side of your knee. That's all you have to do. Try to do it twice per leg, per side, inside and outside. On inside, I know we can only go so high, but you wanna try to get the full range of motion from the inside of the knee to as high up on the inner thigh as you can. And that's as easy as it is. Now you can do this for your lower back, upper back, and plenty of other areas. Just knead it like you're kneading dough. It's not hard, it's not technical, and you don't have to be anatomically inclined to be able to pull this off. Just give it a try.